Urologist explains the hidden danger of improper urination that no one mentions. Gentlemen, if you've noticed that you have to get up 3, 4, or even 5 times a night to use the bathroom, or that your urine stream has become weak, or worse, that you never feel like your bladder is completely empty, then this message is absolutely vital for you. Did you know that nearly 8% of men over 50 make a serious mistake every single time they urinate, thinking it's perfectly normal? Today, I'm going to reveal that hidden habit silently damaging your prostate and weakening your bladder without you even realizing it. And I promise you, if you stay with me until the end, you'll not only discover what that mistake is, but also learn the correct technique that can change your life starting today. This knowledge can help reduce prostate inflammation, improve urine flow, fully empty your bladder, and most importantly, help you sleep through the night without interruptions. This is a silent problem that affects your energy, your mood, and your quality of life. Far more than you think, my friend. So stay with me, and you'll learn the truth that could transform your daily routine forever. My name is Dr. Daniela Ramirez. I'm a urologist with over 15 years of experience, helping men across the United States and Latin America regain control of their prostate health. Over the years, I've seen thousands of cases of men suffering in silence, unaware that a simple change in how they urinate could make a world of difference. Believe me when I say that most prostate issues can be prevented just by correcting one small habit. The truth is, most men have no idea how much their urination habits affect their prostate health. They think it's something trivial, but it's not. This simple act, when done incorrectly, can trigger a series of serious urological problems. Benign prostatic hyperplasia, chronic prostatitis, and that frustrating, exhausting need to wake up several times each night to use the bathroom. And let me be very clear, many of my patients tell me, "Well, doctor, I'm getting older. It's normal to get up a few times, right?" And my answer is always the same. No, sir, it's not normal. And it doesn't have to be that way. To understand why this mistake is so harmful, let's take a quick look at your anatomy in simple terms. Think of your bladder as a small water balloon. It fills and holds urine until you're ready to release it. Just below that is your prostate, a small walnut-sized gland that completely surrounds the urethra, the tube that carries urine out of your body. The prostate acts like a valve that controls that flow. Now, as men age, the prostate naturally grows larger. It happens to everyone. And that's when the mistake you make in the bathroom becomes your worst enemy. Because every time you urinate the wrong way, you're putting enormous pressure on a gland that's already sensitive and vulnerable. And now comes the truth I promised to reveal. The most common and destructive mistake men make when urinating is pushing or straining with the abdominal muscles to force urine out faster. Yes, that's right. Every time you bear down, thinking it'll help you finish more quickly, you're actually causing harm. I know what you're probably thinking. But Dr. Daniela, sometimes my stream is weak or it stops halfway through. What am I supposed to do? It's natural to feel the urge to push, especially when you're standing at a public urinal, in a hurry, or feeling like you're almost done but not quite. But that habit, my friend, is exactly what's hurting your prostate, weakening your bladder, and disrupting your nights. I completely understand. I've heard this exact same concern from hundreds of my patients over the past 15 years. And trust me, you're not alone. But let me explain what's really happening inside your body when you push or strain during urination. Each time you bear down with force, you're creating what we call, in medical terms, massive counterpressure. Instead of letting your bladder contract naturally and efficiently to release urine, you're forcing the process in an unnatural, harmful way. That excessive pressure travels directly into your prostate and your bladder. Now, if your prostate is already slightly enlarged or inflamed due to age, that added pressure becomes like a constant mechanical stress on the gland. Every single day, several times a day. Imagine pulling or pushing on your prostate like that over and over again. That repetitive strain worsens inflammation and swelling dramatically. But there's something even more dangerous. That pressure can actually cause urine reflux, meaning that instead of the urine flowing out as it should, some of it gets pushed backward into the bladder, creating a pocket of stagnant fluid. This is what we call post-void residual urine, urine that remains trapped inside the bladder after you finish. And that's where the real trouble begins. That residual urine becomes the perfect breeding ground for bacteria, leading to recurrent urinary tract infections, which in turn inflame the prostate even more. Do you see the vicious cycle? Pressure leads to inflammation, which leads to retention, which leads to infection, then even more inflammation and pressure. It's a painful loop that can last for years if you don't break it. And here's something else most men don't realize. When you push every time you urinate, you're confusing your bladder and weakening the muscles that control it. There's a main muscle inside your bladder called the detrusor muscle. It's responsible for contracting naturally to expel urine. But when you constantly help it by straining with your abs, it becomes dependent, lazy even. Over time, it loses its natural tone and strength. In medicine, we call this condition hypoactive bladder or lazy bladder. The result? You start feeling the urge to urinate more often, even if your bladder is only partially full, because it never empties completely. You go to the bathroom every 30 minutes, you wake up multiple times a night, and your sleep and your energy gradually fall apart. I've seen it countless times. When a man stops sleeping well, his hormones shift, his focus drops, his mood changes, and his overall health declines. This bad habit isn't just damaging your prostate, it's stealing your rest, your energy, and your sense of well-being. But here's the good news. There is a simple, natural, and completely free solution. You don't need surgery, you don't need expensive medications, you just need consistency, awareness, and practice. The correct technique you should start using today is called relaxed urination, and it's exactly what it sounds like, allowing your body to do its job without effort. Urinating should be an act of relaxation, not of force or strain. From now on, every time you feel the urge to urinate, go to the bathroom right away. Don't hold it. Once you're there, take your time. No rush. Instead of pushing with your abs like you've done your entire life, do the opposite. Breathe deeply, relax your shoulders, loosen your body, and let the urine flow naturally. Your bladder knows what to do. You just need to stop interfering. That's the key to relieving pressure, reducing inflammation, and reclaiming control of your prostate health. Relax your abdominal muscles completely. Let go of all the tension in your pelvic floor and lower body. Imagine that you're simply allowing the urine to flow out on its own, effortlessly, as gravity and your body's natural reflexes do the work. Don't force a thing. Focus instead on your breathing, slow, deep, steady breaths. Relax your shoulders, your chest, your diaphragm, and let your body handle the rest. The flow should start and stop naturally without strain. And here's something crucial that I want you to remember. If your stream stops before you feel completely empty, resist the almost irresistible urge to push or strain to get the rest out. Instead, pause for a few seconds, stay calm, and keep your bladder completely relaxed. This simple moment of stillness gives your detrusor muscle a second chance to contract naturally on its own, allowing the remaining urine to leave your bladder without creating harmful pressure. This little act of patience is one of the most powerful habits you can build to protect your prostate health long-term. Now, to help you fully master this technique and protect your prostate for good, I'm going to share 3 extra tips that I've seen transform my patients' lives over the years. First, the position you urinate in matters a lot. Most men prefer to urinate standing because it's faster or more convenient. But if you're already experiencing symptoms like a weak stream, dribbling at the end, or frequent urges to go, you need to hear this. Multiple clinical studies have shown that urinating while sitting is the most effective and natural position for achieving a full, relaxed bladder emptying. Sitting helps the pelvic muscles relax completely, which allows urine to flow freely without abdominal strain. I know that culturally, many men in the US feel awkward admitting they sit to pee, but believe me, your prostate will thank you. This has nothing to do with masculinity. It's about health, comfort, and the ability to sleep peacefully through the night. Second, never rush. Give yourself enough time in the bathroom, even if it means taking an extra minute or two. If you're in a hurry, it's better to wait until you actually have time to relax than to force your body when it's tense. Rushing is the enemy of a healthy prostate. Patience, on the other hand, allows your body to do what it's meant to do naturally and without stress. Third, there's an advanced technique that few men know about, but it's incredibly effective. It's called double voiding. After you've finished urinating in a relaxed state, lean slightly forward, whether sitting or standing, and wait about 5 to 10 seconds. Often, this gentle movement helps release any remaining urine that didn't come out the first time, ensuring a more complete emptying of your bladder and significantly reducing the number of nighttime trips to the bathroom. And let me answer a common question I get from my patients. Dr. Daniela, if I don't push, I feel like something's left, and then I get some dribbling afterward. What can I do? Is there any device or solution for that? Excellent question. That dribbling you feel afterward is not because you didn't push hard enough. It's because of the residual urine left behind when you strain. The answer isn't more force, it's more patience. Apply the double voiding method I just taught you. Wait those few extra seconds, lean forward gently, and let your body release what's left naturally now. Regarding medical devices, yes, there are options such as urethral stents, small tubes that keep the urethra open, and a relatively new procedure called Urolift, which uses small implants to lift and separate the prostate tissue blocking the flow. But please understand, these are for severe cases only, when the obstruction is truly significant. Before ever considering surgery or devices, I strongly recommend practicing this natural, relaxed urination technique every single day for at least 30 days. Give your body a chance to heal and relearn how to urinate correctly. I've witnessed incredible recoveries from men who improved dramatically just by changing this one habit. Don't give up before trying it. You owe it to yourself to let your body restore its natural rhythm. And while we're on the topic, let me clear up another question I often get. Do women also wake up multiple times at night to urinate? The answer is yes. Women can also suffer from nocturia, but for completely different reasons: pelvic floor weakness, infections, diabetes, or simply drinking too much before bed. But since women don't have a prostate, that's a subject for another video dedicated just to them. Now, let's talk about lifestyle habits outside the bathroom that also play a huge role in your prostate and bladder health. Hydration is key, gentlemen. You must drink enough water throughout the day, spaced evenly from morning until late afternoon. However, avoid drinking large amounts right before bedtime. I recommend that my patients have their last glass of water at least 2 hours before sleeping. And there's something else crucial. Cut down on caffeine and alcohol, especially in the afternoon and evening. Why? Because both are strong diuretics. They make you produce more urine and irritate your bladder and prostate. Coffee, energy drinks, soda, tea, beer, whiskey. These might feel comforting, but they're working against you if you're dealing with prostate issues. I'm not saying you have to give them up forever, but you should seriously limit your intake if you want better results. And speaking of home remedies, I've read comments online where people claim that drinking Coca-Cola with lemon helped them sleep better that night. Now, I respect everyone's personal experiences, but as a medical doctor, I must tell you, that's not a scientifically valid remedy. Coca-Cola is loaded with sugar and caffeine, both of which irritate your bladder. While lemon does have anti-inflammatory properties, that mix isn't something I could ever recommend as treatment. Maybe it worked for someone once, but that was likely coincidence, not cause. What I do recommend are solutions backed by solid medical evidence, the kind that truly works and helps you long-term. So let me summarize everything clearly for you, my friend. The biggest mistake damaging your prostate day after day is pushing or straining your abdomen while urinating. That creates brutal pressure, worsens inflammation, leads to residual urine retention, raises infection risks, and traps you in a vicious cycle that's hard to escape. The solution? Practice relaxed urination. Breathe deeply, release your abdominal tension, let the flow happen naturally, and avoid forcing anything. Combine this with sitting down to urinate if you have symptoms. Never rushing. using the double voiding technique, staying properly hydrated during the day, but limiting fluids at night, and reducing caffeine and alcohol. Making these small but powerful changes will not only protect your prostate, but also transform your quality of life. You'll sleep better, feel more energetic, reduce infections, and finally enjoy that full sense of relief every time you go to the bathroom. Trust me, I've seen it happen countless times. When a man learns to listen to his body responds with strength, balance, and vitality. Start today, because your prostate, your sleep, and your health will thank you for it. If you found this information helpful, if you feel like you've learned something truly valuable today, please give this video a like and share it with a friend, a brother, a coworker, or any man you know who might be silently struggling with this issue. You have no idea how many men suffer quietly because they're embarrassed to talk about it or simply don't know what's going on with their bodies. By sharing this knowledge, you could literally change someone's life. And now, I want to challenge you with a personal 14-day challenge. For the next 2 weeks, practice the relaxed urination technique exactly as I've described. Every single time you go to the bathroom, be consistent, be patient, and observe how your body responds. After those 14 days, come back here and tell me in the comments what you noticed. Did you sleep better? Did your stream feel stronger? Did you reduce the number of times you had to get up at night? Share your experience, because your testimony could encourage other men who are still skeptical to take that first step toward improving their health. And if you haven't already, make sure to subscribe to my channel for more practical, science-based information about men's health, prostate care, hormonal balance, and all those sensitive topics that most men are too shy to ask about, but that are absolutely essential for your quality of life. My name is Dr. Daniela Ramirez, and my mission is to help men across the United States and Latin America understand their bodies better, prevent disease naturally, and regain their confidence and vitality. In my next video, I'll be revealing 5 specific foods that can reduce prostate inflammation in as little as 21 days. These are common foods, most of them probably already in your kitchen, but you may not realize how powerful they are when it comes to protecting your prostate. You don't want to miss it, so make sure you turn on notifications by clicking the little bell icon below. And before we wrap up, I have one last question for you. When you urinate, do you usually do it standing or sitting? Vote in the poll I'll be posting in the community tab, and in 3 days I'll share the results with you. I think you'll be surprised by what we discover together. Take good care of yourself, my friend, and remember, your health is in your hands. Small, consistent changes lead to massive transformations over time. You deserve restful sleep, steady energy, and a body that works with you, not against you. I'll see you very soon in the next video, with more guidance, more knowledge, and more ways to help you live with strength, balance, and lasting vitality. If you found this video valuable, if something finally clicked, and you learned how to take better care of your health, please give it a like and share it with someone who needs to hear this message. A friend, a brother, a coworker, maybe even your dad or your neighbor. You'd be surprised how many men are struggling silently, either out of embarrassment or because they simply don't know what's happening to them. Sharing this video could make a real difference in someone's life. Now, I want to give you a challenge, a personal one. I call it the 14-day Relaxed Urination Challenge. For the next 2 weeks, every single time you go to the bathroom, practice the relaxed urination technique we discussed. Don't force. Don't rush. Just breathe, relax, and let your body do its work. After 14 days, come back here and share your results in the comments. Did you notice a stronger stream? Fewer nighttime trips to the bathroom? Better sleep? Your experience might be exactly what another man needs to hear to start making changes himself. And if you haven't already, don't forget to subscribe to my channel for more science-based, practical advice about men's health, prostate care, urinary wellness, and all the topics men often feel too embarrassed to ask about. But absolutely, my name is Dr. Daniela Ramirez, and my goal is to help you understand your body better, protect your prostate naturally, and live a longer, stronger, and healthier life. In my next video, I'll reveal 5 everyday foods that can help shrink prostate inflammation in as little as 21 days. They're not exotic supplements or expensive treatments. These are foods you probably already have in your kitchen, but never realized how powerful they can be. You won't want to miss that one, so make sure to turn on the notification bell right now. And before you go, I have one final question for you. When you urinate, do you usually do it standing or sitting? Vote in the poll I'll be posting in the community tab, and in 3 days, I'll share the results, I promise. You'll be surprised by what we find. Take care of yourself, my friend. Remember, your health is in your hands. Small, consistent habits can transform your nights, your energy, and your confidence. Start today, take control of your prostate health, and I'll see you in the next video with more insights, more science, and more ways to help you live the strong, balanced, and vibrant life you deserve.